Vincent Carroll speaking, tutorial number 29, ulcerative colitis. From a Western medical point of view, ulcerative colitis is often described as an autoimmune disease. It's characterized by patchy inflammation of the large bowel and rectum, and that often leads to a sloughing off of the inner lining of the large bowel, creating pain, creating blood, and creating the expulsion of membrane. Membrane and blood and feces are expelled in a painful way to a greater or lesser extent. It depends on how much, I suppose, of the large bowel and rectum is affected. Usually it's often relatively small patches, but sometimes catastrophically it can be perhaps the entire large bowel and rectum that is affected. In that case, it can present as an acute emergency. It's diagnosed by a colonoscope, and you find raw red lining and a thinned out gut, because obviously the inner lining has been expelled. So biopsies sometimes are taken, but they have to be taken with great caution because you don't want to perforate the already thin wall of the large bowel. But the purpose for taking a biopsy is to ensure that there's no cancerous condition there, because there's a connection between ulcerative colitis and carcinoma of the large bowel. More of that later. From an acupuncture point of view, we're talking about heat in the large bowel, the suddenness of it, the pain associated with it, and the rapid expulsion of blood and membrane. And as bright red blood all corresponds to heat, all the signs of heat in the large bowel. So from our point of view, we have to ask the question, where's the heat coming from? And many people will claim there's a dietary connection, perhaps by taking very hot spices or whatever. Very often that can trigger episodes of ulcerative colitis. So people know to navigate carefully around what they eat. But there's more involved than that. And what is involved at a deeper level is the generation of heat by the body. And that's often a mental emotional heat. I mean, ask anybody who has ulcerative colitis, they'll normally talk about rolling episodes of exacerbation and remission. And these rolling episodes of exacerbation and remission are often associated with stress from the person's point of view. They'll make the connection themselves. Stress from our point of view means liver qi stagnation. And when liver qi is stagnant, the yang builds up, the liver yang builds up, and it can rise, but it can also stay put in the large intestine and or the lower jiao area, which includes the large intestine, of course, and that can sometimes cause the signs and symptoms of what, from a Western medical point of view, you would call ulcerative colitis. Ulcerative colitis is often very satisfactory to treat from an acupuncture point of view because you take heat out. You take heat out quickly, and sometimes the heat lingers there as deep toxic heat. So large intestine 10 bilaterally are very good points to use. Also, I would use the accumulation point of the stomach channel, which is stomach number 34, which is just above the knee on the outer side of Tusung of the patella at a 45-degree angle. I would use all the normal heat points, obviously, so large intestine 4, large intestine 11, Sanja number 6 as well is a very useful point. I would very gently, it depends how robust the person is, of course, but I would very gently pop small needles along the large bowel, that's on the left descending side, probably over the left stomach channel, and probably 1 or 2 sung lateral to the left stomach channel, and I would needle there very superficially to take heat out, and very often they blush up very, very red. I'm inclined to put stomach 25 bilaterally in, that's 2 sung each side of the navel of the belly button, and the reason for that is that applies the brakes to the gut as well. That can be a useful point. So the whole emphasis is on deacceleration. Pericardium 6, as always, for small intestine, for small smooth muscle matters, is always a very, very good point. So all these sort of whole purposes is to try to deaccelerate a very acute condition, to buy time, and then ask the obvious question, why is it affecting that person and not the person sitting beside them on the bus? There's obviously distinctives, there's obviously underlying reasons, and we have to explore for that. And usually, I mean, the patient themselves will tell you, usually the underlying reason tends to be what they would describe as stress, and what we might describe as a liver qi stagnating in the lower jaw. So you'll ask them all the obvious questions there about, is qi stagnant, where are they at in their life, what's happening to through them from a job point of view, from a home life point of view, so on and so forth, looking for evidence of stress. Or stress, again, could just be the busyness of life. I mean, it could be very sort of just embracing too many things to happen, creating a sense of congestion in life where deadlines are being met with great difficulty. I mean, all of that sort of is a sign as well of it can cause entrapment, and probably entrapment is probably the best word to use rather than stress very often. So I'm inclined therefore to de-accelerate the situation as much as possible by taking heat out. One thing I'm very conscious of is that there is a correlation, a weak correlation, but a correlation nonetheless between carcinoma of the large bowel and ulcerative colitis. So one has to be just aware of that as well. But there is a subset of people with a genetic predisposition to carcinoma of the colon who have ulcerative colitis. Now, thankfully, they will already have been identified from a hospital point of view, and they will be probably get on an annual basis a colonoscopy to make sure that there's no carcinoma of the colon developing. They are a well-recognised subsection of people with ulcerative colitis, but still a tiny minority. But nonetheless, they have a substantial risk of developing carcinoma with the passage of time. And in some cases, I mean, some academic articles will advocate for the prophylactic removal of the colon to prevent the possibility of carcinoma of the colon arising. That'd be very unusual this side of the Atlantic, but it's something that's practiced in the States quite a lot from a prophylactic point of view, because the risks are incredibly high of carcinoma developing within this subsection. And that's a very, very small subsection, I stress, of people with ulcerative colitis. But the majority of people with ulcerative colitis nonetheless still have a certain smaller risk, much smaller risk of developing carcinoma of the colon, which again, from an acupuncture point of view, is a liver qi stagnation, where the stagnation of liver qi stagnates, causing blood to stagnate. And what are carcinomas? Many of the textbooks refer to them as blood masses, where the qi does not move blood because the qi is stagnant, and blood mass develops, and blood mass very often is another way of describing a carcinoma. So we need to be very aware of that. And of course, the qi stagnation very often is the precursor of ulcerative colitis, because it provides the heat, it provides the acceleration that causes what from a Western medical point of view would be described as ulcerative colitis. So it's a fascinating sort of connection there. So what do? Somebody presents, they'll tell you they have ulcerative colitis. It's highly unlikely you'll make that original diagnosis. So though you might, and why not? You know, if a person has a bloodied flux of membrane, feces and blood with a lot of abdominal pain, they'll probably go to the casualty rather than you, first of all, but you know, you never know. So when they come and tell you they have ulcerative colitis, you must do two things. If it is a flare-up, well, you will deaccelerate them by taking the heat out and settling the gut by putting the brakes on the gut with stomach 25, and then ask, of course, what is the reason, what happened. Ask them for their own sort of intuitive sort of opinion as to why this flare-up has occurred, and they'll probably be 100% accurate. They tell you exactly what it is, and it's probably associated with what we would call liver qi stagnation. So get working on that is what I'd say. Liver 3, gallbladder 34. Would you drag it all down? Interesting question. Stomach 44. My worry in doing so is you drag a bit too much down. I'm inclined not to do that. I'm inclined to expel locally, and that's why I put in all the little points, small diameter needles, short needles, all over the area of the left iliac fossa area, which is the descending, where the colon descends, because that very often is the majority area where ulcerative colitis occurs, over the descending colon and rectum. But it can be the transverse colon, it can be the ascending colon as well. So palpate the abdomen and try to find out where the pain is. And whenever there's pain or discomfort, they'll show you themselves. Then pop in a needle to see can you take heat out, because when you take heat out locally, you deaccelerate locally, and that's very important. Of course, take heat out systemically as well, because that's the fuel that causes the ulcerative colitis to be maintained. So we're talking about taking out heat from the body in general. Thank you.